Welcome back. If you are joining us from part 1, you already know how to rid 5 important tongue signs: the pale tongue, the red tongue, the purple tongue, the thick white coating, and the yellow coating. Each one tied to a specific pattern in the body. Each one paired with practical steps you can take right now. If you are new here, I recommend starting with part 1 first. The link is in the description. But even if this is your first time, everything we cover today stands on its own. Because in this second part, we are going into the patterns that are most often linked to emotional health, structural imbalance, and the kind of chronic depletion that builds silently over years. These are the signs many people carry every day without realizing what they mean. Let's get into it. If you haven't subscribed to Nature Bliss Care yet, now is the perfect moment. Hit subscribe and tap the notification bell. We upload practical integrative health content every week, and you deserve to be the first to see it. 6. Swollen tongue with teeth marks. This is one of the most frequently seen tongue patterns, and many people don't even realize it's there until they look carefully. The tongue appears enlarged or puffy, and along the edges you'll notice scalloped indentations that mirror the shape of the teeth. In TCM, this almost always points to spleen qi deficiency or dampness accumulation. It is important to understand that the spleen in TCM isn't just the physical organ you know from anatomy. It represents the entire digestive system's ability to transform food into usable energy and distribute fluids throughout the body. When this system underperforms, fluid starts to pool, and the tongue swells to reflect it. From a biomedical standpoint, a swollen tongue can accompany hypothyroidism, allergies, chronic inflammation, nutritional deficiency, mouth breathing during sleep, dehydration, or other systemic conditions. Symptoms that often travel alongside this pattern: tiredness shortly after eating, bloating that comes and goes throughout the day, loose or soft stools, strong cravings for sweet foods, a heavy, leaden feeling in the body, low motivation or initiative, water retention, mental fogginess, poor muscle tone. Strengthening the digestive center. Avoid heavy, overly large meals. Instead, eat smaller, more regular amounts throughout the day. Focus on warm, cooked foods, soups, congis, steamed vegetables, and stews. Reduce cold drinks, excess raw food, sugar, and refined carbohydrates. Incorporate ginger, garlic, and warming spices regularly. In both TCM and naturopathic medicine, these are not merely flavorings, they function as digestive tonics. Acupressure, spleen 6, Sanyangio. Located 4 finger widths above the inner ankle bone, just behind the shin bone. This versatile point strengthens digestive function, improves fluid balance, and supports hormonal health and overall vitality. It is one of the most widely used points in the entire TCM system. Press gently for 1 minute on each leg. Use daily for 4 to 6 weeks. Also use stomach 36 and spleen 9 for additional digestive and fluid support. Caution: avoid during pregnancy. Laboratory tests to consider: thyroid function test, fasting blood sugar, lipid profile, urine analysis, morning serum cortisol. 7. Cracked tongue. Cracks on the tongue can range from faint, shallow lines to deep, prominent fissures. In TCM, these cracks most often suggest EN deficiency, fluid insufficiency, stomach EN deficiency, or long-standing internal dryness. Think of it as the body's tissues becoming progressively less moistened, like dry earth that begins to crack under prolonged heat. 1 important caveat: some people naturally have a fissured tongue from birth. This is a benign anatomical variation and does not automatically signal illness. The clinical significance arises when cracks appear or worsen over time, especially alongside other symptoms. Symptoms that tend to accompany a cracked tongue due to EN deficiency: dry mouth, particularly at night, waking thirst, constipation, acid reflux, a feeling of heat in the palms and soles, called 5-palm heat in classical TCM, night sweats, restless or broken sleep, burning sensations in various parts of the body. How to restore fluids and rebuild EN. Reduce or eliminate alcohol and smoking. Both are profoundly drying to body tissues over time. Avoid excessive spicy foods. Favor moistening foods instead, Soups, okra, pears, cucumber, avocado, sesame seeds, and good quality fats. These are nutritive in a deep sense, not merely caloric. Hydrate wisely. Start your morning with warm water. Sip small amounts regularly throughout the day rather than drinking large quantities all at once. Occasionally, add a small pinch of quality salt or a squeeze of lemon for gentle electrolyte support. Sleep repair. In TCM, EAN is restored during deep rest, specifically between 11 p.m. and 3 a.m., when the body undergoes its most active repair. Keep a consistent sleep schedule, reduce screen exposure in the evening, and create a quiet, dark sleeping environment. Acupressure Kidney 3 Tai-Chi. Located between the inner ankle bone, medial malleolus, and the Achilles tendon. This is the primary point for restoring the body's deep fluid reserves, kidney EAN. It supports long-term energy and is particularly valuable for people who feel depleted, burned out, or chronically dry. Press gently for 1 minute on each side. Use daily for 4 to 8 weeks, especially if you feel exhausted at a deep level. Also press spleen 6 gently. It supports EAN, blood, and overall fluid nourishment. Caution: avoid both points during pregnancy. Laboratory tests to consider: fasting blood sugar and HbA1c, vitamin B12, iron studies, serum electrolytes, sodium, potassium, magnesium, ANA/autoimmune panel, Sjogren syndrome. 8. No coating or shiny tongue, peel tongue. A tongue with little to no coating appears smooth, peeled, or almost glossy, as though the surface has been stripped bare. In TCM, the tongue coating is generated by stomach qi and reflects the vitality of body fluids. When the coating disappears, it suggests that stomach EAN has been depleted through chronic illness, long-term dehydration, overwork, extreme dieting, or excessive use of harsh detoxes and laxatives. Modern medicine aligns closely with this interpretation. A very smooth, glossy tongue, clinically called glossitis, is a recognized sign of deficiencies in B12, folate, iron, or zinc. It can also appear in malabsorption conditions like celiac disease. Rebuilding from the ground up. The approach here is gentle and nourishing, not aggressive. Avoid crash dieting and extreme fasting. Eat balanced, nutrient-dense meals consistently. Support gut health through fermented foods, prebiotic vegetables, and adequate fiber. A critical principle here: repair before you cleanse. Do not begin any harsh detox protocol while your body is already showing signs of depletion. It will only deepen the deficit. Acupressure combines stomach 36, spleen 6, and kidney 3. Together, these 3 points address the spleen, stomach, and kidney systems, the foundational trio for generating and sustaining body fluids, blood, and vitality in TCM. Laboratory tests to consider: ferritin and iron studies, vitamin B12, serum folate, zinc, celiac antibody screening, H. pylori test, comprehensive metabolic panel. 9. Red tip of the tongue. Now let's zoom in on a specific zone, the very tip of the tongue. A distinctly red tip, isolated from the rest of the tongue body, is one of the most emotionally significant signs in TCM. It points to heart heat. In TCM, the heart system governs far more than the physical organ. It encompasses the mind, emotional state, sleep quality, and what the classical texts call the shun, your sense of clarity, peace, and inner settledness. Common experiences associated with a red tongue tip: anxiety or a buzzing, unsettled feeling, restlessness that's difficult to explain, difficulty falling or staying asleep, vivid, exhausting dreams, recurring mouth ulcers, heart palpitations, feeling emotionally overheated or reactive, bringing calm back to the system. Stop scrolling late at night. This is genuinely one of the most direct modern drivers of heart heat. Reduce caffeine. Build a calming evening routine: breath work, a warm shower, reading, or quiet prayer or meditation. Sleep earlier, ideally before 11 p.m., when the body begins its deepest restorative cycle. Acupressure. Heart 7, Shunmen, plus pericardium 6, Naguan. Heart 7. Located at the wrist crease on the little finger side. Traditionally known as the spirit gate point, calming, grounding, and specifically indicated for anxiety and sleep disturbance. Press and hold for 1 minute on each wrist. Pericardium 6. 3 finger widths above the wrist crease, between the 2 tendons. One of the most clinically researched acupressure points, with documented effects on the autonomic nervous system. Excellent for nausea, anxiety, and chest tightness. Checks and laboratory tests to consider. Blood pressure check. ECG, if palpitations are present. Complete blood count. Thyroid function test. Fasting blood sugar. Electrolytes. Vitamin B12. Serum magnesium. Morning serum cortisol. 10. Red sides of the tongue. The sides of the tongue, particularly toward the middle and back portion, are mapped to the liver and gallbladder in TCM. So, when redness concentrates there, it tells a distinct story. Red sides typically indicate liver qi stagnation that has transformed into heat. In other words, energy was first stuck and stagnant, and over time that stuck energy became agitated and heated. This pattern is extremely common in people under sustained pressure, those who habitually suppress their emotions, or those with hormonally sensitive cycles. Signs that often accompany this pattern: irritability and a shortened temper, premenstrual tension, PMS, breast tenderness, or mood swings before menstruation, headaches, particularly at the sides or top of the head, a bitter taste in the mouth, jawline acne, tight, aching neck and shoulders, disturbed sleep correlated with the menstrual cycle, moving liver qi and clearing the heat. Move your body every day. This is not optional for this pattern. Liver qi moves with physical activity. Walk briskly, stretch, do yoga, dance. Reduce alcohol, which directly burdens the liver. Avoid late-night eating. Create healthy outlets for emotional expression. Journaling, prayer, honest conversation, or breath work. In TCM, suppressed emotion is the most common root of liver qi stagnation. Acupressure. Liver 3, Taichung. Top of the foot, in the hollow between the big toe and second toe. The primary point for moving liver qi and clearing liver heat. Gallbladder 34. Yanglingquan, outer leg, just below the knee. For liver gallbladder tension, muscle tightness, and tendon-related issues. Large intestine 4, Higu, for stress release and moving stagnation through the upper body. Laboratory tests to consider: liver function test, lipid profile, fasting blood sugar, and HbA1c, hormonal profile, FSH, LH, estrogen, progesterone, testosterone. GGT, specifically sensitive to liver stress from alcohol and oxidative load. Uric acid. 11. Tongue movement, your nervous system on display. Most people examine the tongue's appearance and forget entirely about its movement. But this can be just as telling. A trembling or quivering tongue, when held out steadily, points to internal wind in TCM, often reflecting underlying weakness, anxiety, or a depleted nervous system. Mild trembling is commonly seen in people who are severely fatigued or in a state of heightened anxiety. A stiff or deviated tongue, one that doesn't extend straight or that feels difficult to move normally, carries more urgency. In TCM, this suggests severe imbalance or wind phlegm obstructing the channels. From a biomedical standpoint, sudden tongue deviation or stiffness can be an early warning sign of neurological change, including stroke. If this appears suddenly and without explanation, please seek medical attention without delay. Tongue movement is subtle, but in certain situations, it may be the most important thing you observe. The tongue body map, your internal compass. Now that you've seen all 11 signs, it helps to understand why different parts of the tongue matter differently. In TCM, your tongue is not one uniform surface. It is a map, and each region corresponds to a different organ system. The tip reflects the heart and mind. Just behind the tip reflects the lungs. The middle reflects the stomach and spleen, your digestive center. The sides reflect the liver and gallbladder. The back reflects the kidneys, bladder, intestines, and lower burner. This is why a thick coating concentrated at the back may point toward lower digestive or urinary dampness, while a persistently red tip points toward emotional strain and sleep disruption. Once you understand the map, even partial observations become meaningful. You do not need to see all 11 signs to gain something useful. One consistent change, observed over time, is already information you can act on. When should you seek medical care? Tongue observation is a powerful tool, but it is not a replacement for clinical diagnosis. Please don't ignore any of these signs. A tongue ulcer that hasn't healed after 2 weeks. White or red patches that won't resolve. Bleeding from the tongue without obvious cause. Severe or sudden tongue swelling. A blue or purple tongue accompanied by breathing difficulty. Painful swallowing. Unexplained weight loss. Persistent fever. Severe unexplained fatigue. Black hairy tongue that doesn't resolve with improved oral hygiene. A sudden stiff or deviated tongue. This warrants urgent attention. Self-tongue observation gives you clues. Medical investigation confirms and guides treatment. Both matter, and neither replaces the other. Your daily tongue health routine. Here is a simple, practical routine you can begin tomorrow morning. Check your tongue before brushing your teeth or eating. That is when it's most accurate. Brush your teeth and gently clean your tongue. Do not scrape aggressively. Drink a cup of warm water. Eat mostly whole, real food throughout the day. Reduce sugar, fried foods, excess dairy, cold drinks, smoking, and alcohol. Sleep early. Walk daily. Manage stress before it becomes disease. One more practical tip. Once a week, take a photograph of your tongue in the same lighting and from the same angle. Over several months, you'll begin to notice patterns, changes that correlate with your energy, digestion, stress levels, and sleep quality. Your tongue is not static. It changes as your body changes. That is precisely the point. Finally, your tongue isn't showing you random information. It changes before disease appears in blood tests. It sends early signals, if you know the language. This isn't guesswork. It is a system refined over thousands of years of careful, consistent observation. A pale tongue says, feed me. A red tongue says, cool me. A thick coating says, digest better. A purple tongue says, get me moving. A cracked tongue says, restore my fluids. A swollen tongue with teeth marks says, strengthen my foundation. In TCM, we don't wait until the body breaks down before we start listening. We observe. We adjust. We prevent. So tomorrow morning, before anything else, take 10 seconds. Look at your tongue. It may be showing you exactly what your body has been trying to tell you for a long time. Thank you so much for watching both parts all the way through. If this series helped you, please hit like, subscribe to Nature Bliss Care, tap the notification bell, and select all, and drop a comment below. Which tongue sign do you recognize in yourself most often? The teeth marks? The cracking? The thick coating? I read every single comment, and your answer may help someone else feel less alone. Share this with one person who is always tired, always bloated, or always stressed without knowing why. New videos on natural health, TCM body signals, gut healing, and integrative wellness drop every week. Your body is always communicating. We are here to help you listen.